be a nice segue both from our previous session on how we're living in retirement, and yesterday when we heard from Dr. Burke about long-term care. This will be a more umbrella sort of talk about paying for health care in retirement. I think there'll be some elements that will be maybe not surprising to all of you, but surprising to your readers. So it's good to be thinking about these things in terms of work that you're preparing for. Susan Garland is the editor of Kiplinger's Retirement Report. Now, did you take over from Mary Beth? Or
No, Mary Beth worked for the magazine.
Okay.
And Jane Clark took over from Mary Beth.
There you
so
go.
two separate publications. We worked very well together.
And you can see that we use Kiplinger as a great resource in these programs. She was with Business Week magazine for 12 years, where she covered similar issues, all of these retirement, taxes, Social Security, pensions, all of these issues. She's been on the NewsHour with Jim Lehrer, CNBC, Nightly Business Report. So she's done the talk show circuit. She's quite an expert on this, and I'm very glad that she has come back to talk to us about paying for healthcare.
Thank you.
Go ahead.
Okay. Well,
You can
thank
say
you.
it.
I was here last year. I had a lot of fun. It's always great to talk to reporters because I hope to give you some story ideas to bring back to your community. Anyway, I've given you each a copy of Kiplinger's Retirement Report. Picked out the cover. We did something on long-term care, because I probably won't have time to talk about that, but everything you need to know is there. I'm going to give you a little plug about Kiplinger's Retirement Report. I've been there 8 years. I think it's a really good publication, if I do say so myself. Any of you covering retirement, I really think it's really worth spending the $30 a year, 16 pages a month, and you get access to all our back copies for years and years and years. It's been around for close to 20 years, but that's enough. I've done my plugging job. We cover a lot of things, and obviously healthcare for pre-retirees and retirees is a big deal. I want to start off with a New Yorker cartoon that I came across. A bunch of gangsters are sitting around a table and saying, "For me, crime pays for what Medicare doesn't cover." Well, I suppose that's one way to pay for your healthcare costs in retirement, but I'm hoping to come up with, some people may want to resort to crime, but maybe there are other things you can do instead, like buy annuities, a little bit more boring than, holding up a bank, whatever. But, even for gangsters, you got to pay somehow for your healthcare. It's a huge consideration for current retirees and for those planning for retirement in the relatively near term. There's been a little dip in healthcare costs in the past few years, but they will still consume a huge share of an individual's retirement expenses, and people are living longer as well. You may want to take a look at, what's it called? I just did it yesterday. It's called it's a website, livingto100.com. You put in all the different stuff about yourself and your medical issues and so forth, and it gives you an idea of what your longevity is. Who knows if it's right, you could be hit by whatever. But it said I was going to live to 95. I have very mixed feelings about that because, it would be nice to live that long. How will I pay for all my expenses of retirement? Number one, and number two, what will my life be like? But people can at least get a general idea of how long they may live. Just a general idea by looking at lots of longevity websites like that. We did a whole story on that. So if you subscribe to Kiplinger's Retirement Report, you could go and see that story in our archives. Anyway, there's a lot of uncertainty in the years ahead as entitlements such as Medicare, consume a growing share of the federal budget. The White House and lawmakers and the presidential candidates and all candidates will be looking for ways to cut back on things like Medicare and Medicaid. And for the older people, especially, Medicaid pays for a good part of long-term care, nursing home and home care benefits. Only a few, part of the uncertainty, like an example of that, only a few years ago, there was no means testing for Medicare Part B, which pays for outpatient care. Now higher income folks are paying extra for Part B and Part D premiums. Those go for prescription drug plans. The House Budget Chairman, Paul Ryan's proposed budget calls for a premium support program for Medicare, which means you get a voucher and you go out and you buy your health care on the private market, sort of like the new exchanges. And Florida Senator Mark Rubio, who's a presidential hopeful Republican Party, has also endorsed that idea. And President Obama has proposed a surcharge on Medigap supplemental insurance policies so that to encourage people to spend more out of pocket so that they're more sensitive to the cost of the Medicare services that they're consuming. So that adds up to, we don't know what's going to be happening in the future. People need to plan for all sorts of things as far as their health care costs are concerned. They need to plan for health care for 30 years or more. You retire at 65, I might be paying for health care for 30 years. And so when people are planning their retirement budgets, they will list their expenses for utilities and housing and insurance and clothing and taxes. But they really need to get real about their health care expenses. They just can't say, oh, Medicare will pay for this, because this is a really important number. Fidelity Investments, they come out with this number, and maybe Dallas Salisbury, he has his own EBRI number, I don't know if he talked about that, that a 65-year-old couple with average life expectancy would need $220,000 to pay for health care costs in retirement. And this a couple. Average life expectancy is 65 years old. They should be coming out with their new number. They do it every May, and they haven't come out with their new number yet. Last year was a little higher, so things are coming down. It's still a big chunk of money. This does not include long-term care. All right, so you go to a nursing home, this 220, and this 220 is it's a realistic number, because if you look at premiums for Part B, Medicare Part B, and your Medigap coverage, your monthly Medigap, and your Part D prescription drug plan, or your Medicare Advantage plans, it adds up to that pretty quickly. And then you're still not talking about your dental and your vision and some of these other things that these programs do not cover. And this is just for average life expectancy. You could plug in, at least Fidelity used to have a calculator where you could plug in different ages for different people. And so the numbers, if you're living to like in the 90s, the number will go up to 400,000. So that's a really eye-opener for a lot of people. And the EBRI has another number. Women are going to be more, it's going to cost more. A man with average life expectancy who wants a 90% chance of having enough savings would need $122,000, and women would need $139,000 for their out-of-pocket costs during retirement for health care. And these numbers are on their website, on EBRI's website. And to a great degree, healthcare is a local story. I think there are stories in your community, because the exchanges, the new Obamacare exchanges, are county-based in a way. I mean, they're all people are they might be state-based exchanges, but they're basing their prices and their exchanges on what's going on in the county. And there's a huge variance in health costs depending on where you live. A lot of data out there depending on county by county, state by state, what costs will be depending on where your community. Companies are dropping coverage for early retirement, retirees in your community as well, and insurance companies set their premiums based on locality. So it's a local story, it's a national story, but it's a local story as well. I was going to talk about 3 different areas. One was the pre-65 group, people who might be early retirees, self-employed, people between 55 and 65 who are not yet eligible for Medicare. Then I was going to talk a little bit about Medicare, and then I was going to talk about specific ways that people can pay for health care. But I think I'm going to start with the third part first, just to go through the list. Now that you know some of the numbers and that what you may need to pay for out of pocket, and some strategies that people can use, things that you can consider in writing your stories. Whoops. First of all, when you do your retirement planning, anybody who sits down and does retirement planning, as I said before, you need to plan. You do your budget. A lot of budgeting stories out there and how to sort of pay for retirement costs. And so you need to plan for at least $220,000 for an average couple. And there needs to be a line item there, along with utilities and food and housing costs. And you can sort of get a general idea of what you need to be thinking about, because even though Part B premiums are fixed, for now, they're $100. The standard one is $104.90. They will be going up with inflation over time. So people could sort of say, okay, I know what my premium's going to be probably, and I know what my Part D premium may be, and I know what my Medigap premium may be, and be able to sort of budget for this over the long term. Be sure to plan for dental as well. This is one of the unexpected expenses that people don't think about, really. They have Medicare and all that, but you get a crown. My mother's 91, so I have a good chance of living to 95. She just spent $2,500 for a crown or implants and stuff like that. So these things just pop up along with repairing your roof. We recommended Retirement Report and the magazine as well to set aside money for emergency costs when you do your retirement planning. We always say 2 to 5 years of emergency costs, and those, so that way that you're not pulling out of the stock market. Especially in bad years, you don't want to have to sell a stock when the stock is down during a downturn. I don't know if people have been talking here about sequence of returns, whatever. If they haven't, I'm not going to get into it. But it's basically when the stock market's down and you retire when the market is down, you're pulling money out, you're selling stocks at a down market, and you're never really going to recover that. So better off putting aside a bunch of money, including, and I'm not even saying you need to set $220,000 for right now, but it's something that people should be thinking about replenishing over the years when they're taking their stock portfolio, they're rebalancing their accounts, pull some profits, put it into emergency reserve for your health care and your other emergency costs. Also, I know that Mary Beth Franklin talked about Social Security. If people can do it, any way you can get extra income, delay Social Security beyond 62. I'm not going to get into all the strategies with couples. I know Mary Beth covered that, but it will give you 76. If you delay between 62 and 70, you'll get 76% more over your lifetime, not including cost of living adjustments. And that's a really good. You could sort of look at that money as your maybe your health care pot, so to speak. And we've done numerous stories on Social Security strategies. So you can go on Kiplinger.com. You could look at my name. You could look at Rachel Sheedy, who's the managing editor, and we've uploaded a lot of our Social Security strategy stories. Another way that people can think about paying for health care is to buy annuities. I know a lot of people are probably down on annuities. A lot of financial planners don't like it. And one reason when you hear financial planners say they don't like annuities, there's one good reason. A lot of certified financial planners who manage your money, they get like 1% to manage your money. If you take money out of that pot, let's say $100,000, that's like less money that they have to in their fees. That's not the only reason that people should be concerned about buying annuities, but that's something you need to keep in mind, that there's a conflict of interest for everybody. So I would not think about getting an annuity. They only think about getting an annuity if you have a super large portfolio, and if you have a pension plan, because what you're looking for is a guaranteed stream of income over time to match your fixed costs. So let's just say you add up all the utilities and maybe your housing costs, and insurance, and everything you know will be fixed. And and your health care costs, your yearly health care costs that you know, your Part B premiums, Part D premiums, and so forth. And then you look at your Social Security and so forth. If there's a gap, maybe you want to take out to buy an annuity. And I'd only recommend a couple of types at this point. One would be an immediate fixed annuity. And that's the kind of annuity where you take a chunk of money, you basically buy a guaranteed income stream that starts immediately, so that you know for the rest of your life you will be getting that money over time. So let's say you pay an insurance company, so let's say you're a 65-year-old woman, and you need $500 a month to pay for these fixed expenses. You would be spending $95,000. The downside, of course, is that you can't get your money back. If you die early, that's it for you. But you're going to be let's say you spend the $95,000, next day you die. Well, oh well. But you've got worse problems because you're dead. So but maybe at least you could sleep well at night, knowing that these expenses while you're alive, of course. If you're dead, you're sleeping very well. And you won't have to worry about your health care costs of retirement anyway. So you won't have the money for your heirs and so forth. But at least you know these expenses are covered. Now, the downside is low interest rates. Payouts are really low. But it's something that people should be thinking about. Another type of annuity is a deferred deferred fixed annuity. So it works the same way as an immediate annuity, but instead of getting the money immediately, what you do maybe at 55 or 65, you buy this annuity and you say, okay, I want this to kick in 10 years from now. So let's say you're 65 years old and you want $500 a month to kick in 10 years because, right now you're okay, but you're a little concerned about what's going to happen down the road. Instead of spending $95,000 for the immediate fixed, you spend $42,000, and it kicks in later, down the road when you may need it most. There's another type of annuity called the longevity insurance. I don't know if Dallas Salisbury spoke about this. Dallas is a big proponent of this. He has one he owns one of these himself. So
I'm sorry, called what?
it's called longevity insurance. And it's a deferred fixed annuity with a really long, period of time between the time you buy it and the time it kicks in. This could be for healthcare, could be for anything. So typically these insurance policies work by you pay. At retirement at 65, you buy this insurance. It kicks in 20 years from now. At 85, when you're really old and you're really concerned about running out of money, it's a very hard concept for people to understand because people think, oh my God, I'm not going to live to 85, but there's a good chance you will be. So with a longevity insurance, at 65, you could pay $13,000. Okay, wait a second. Let me just try something else. Let's say at 55, at 55, you want to buy $1,000 of income for when you're 85 years old. You pay $18,000 at 55.
$1,000 a month.
$1,000 a month. Yes, I'm sorry. These are monthly figures. So you'll pay $18,000 at 55. If you at 65, you would pay. I don't have these numbers right, so never mind. But so these are going to become more popular. They're already becoming more popular. Longevity insurance. A number of companies sell them. Actuaries like Dallas love it because it sort of works in their brain that, you start, a little bit of money now and you get a big payoff down the road when you need it. And what a lot of people say is that this enables people, knowing that you're getting this money in the future, this means you could be a little bit more aggressive with your investments now because you're not going to be worried that much about running out of money down the road. You've got this fixed amount of income. The problem with this is that, you could buy it and it kicks in at 85 and you die at 82. There you go. You've spent this money and, and you're dead. You won't care that much. But anyway, one way you could check out all these different annuity numbers is go to a website called immediateannuities.com. And you could plug in all these different numbers. You could say, I have $100,000 in cash. This is what I'll get, monthly. Or you could say, I need this monthly, and this is what I need to spend. You could do it with a joint life, so that your, spouse. You could do it with your spouse. You could do it, you could get an inflation factor if you want. But it's really, if you're going to do an annuity, it's really not worth getting an inflation number because that just is going to be. You're going to be getting less money. It sort of defeats the purpose. There are some more complex annuities out there. I'm not crazy about variable rate annuities. They're really hard to understand unless you get somebody who really understands it. It's hard to. There's so many moving parts. We have a great source on that. I don't want to, Mark Cortazzo. He has a financial planning firm in Parsippany, New Jersey, very accessible to the press. He's really great at this. But so here are some new annuities that are addressing healthcare. Liberty Mutual Freedom Series Builder. It's a deferred fixed annuity, and you could add a rider to it that allows you to withdraw money without paying surrender fees if you or your spouse becomes seriously ill. So usually these annuities, you keep the money in for a while until you want to annuitize these sort of investment vehicles. But this allows you to pull money out without paying money. Usually there's a 5 or 7 year surrender fee, which means that if you don't, if you pull the money out earlier, you have to pay a huge charge, maybe 10% of the value of the annuity. This, you pay a little extra up front for this rider, but if you get really sick or your spouse gets sick, you can pull the money out without the charge. So there are new products that are coming out to help people address later in life healthcare needs. Another thing, if your older readers have permanent life insurance, whole life universal life insurance, you could take partial loans perhaps, partial withdrawals, or policy loans to pay for health care and other expenses without having to pay fees. There could be tax payments if you withdraw more than your original investment. And if you take a withdrawal for your health care and you don't pay back the money or pay back the loan, you'll reduce the death benefit for your heirs. But at least you'll be allowed to take some money out of your life insurance if you have some kind of emergency medical expense. So that's another way people are paying for health care. And with many of these universal policies, you can accelerate your death benefits if you are diagnosed with a terminal illness. So life insurance experts out there, life insurance companies can talk to you if you ever want to talk about these things, could talk to you about accelerating your death benefits so that instead of leaving it for your heirs, you take it for yourself. Another option for people who want to pay for their health care is to take a reverse mortgage. This is for people who are 62 and older. You're living in your house, and instead of paying a forward mortgage like many of younger people pay, you take the mortgage out and you pay back over time. You're with interest. What you do is that you don't have to pay the mortgage back until you die, or your heirs will pay for it. You move out. Or, let's say you sell the house, or you move out for more than 12 months. And at that point, you pay back the loan. And you could take this money out as a lump sum. You could take it out as a line of credit. The rules are changing all the time on these loans. We've recommended not to take this out too early, because what happens is that the interest rates accrue over time. So let's just say, I'm making these numbers up. You want to take your house is worth $500,000. You take a $300,000 loan, or $200,000 loan, and over a period of time, you pay it back. You'll be paying maybe back $400,000. As I said, I'm making these numbers up. You can get these numbers out there. And so what happens if you start too early? Let's say you're 62. We had somebody that an anecdote a number of years ago, 62-year-old couple, and they looked at this reverse mortgage as sort of a cash cow. They sent their kid to school. They went on a around-the-world trip with their children. They did all this great stuff. And the problem is, when you really need the money at 80, 85, you need to go into a nursing home, or you need to go into assisted living. You have a major medical expense. There won't be much left in your house as an equity to pay for this stuff, because you need to pay this loan back, and it would have eaten up over a period of time a good part of your equity because of those interest rates built up over a period of time. We've written a lot of stories. We've uploaded them on our website, kiplinger.com, so you could take a look at how these reverse mortgages work. But it is another, if you're 80 years old and you're sort of running out of money, and you need to pay for your Medicare premiums or some medical expense, it's a good way. You get this monthly income, and it's a good way to pay for your health care costs. We do not ever recommend it for a spouse's nursing home. Let's say you're living in the house and you want to pay for your spouse's nursing home. It will devour your equity. I would not do it for nursing home costs. You could just sort of maybe a better alternative is, I hate to say, to spend down your assets and have Medicaid kick in. The spouse does keep the house. Another good option, I don't know if anybody has spoken to you about health savings accounts. Yes? Anyway, did anybody talk to you about those and how they work? Okay. Health savings accounts, some of you may even have them with your insurance at your employer. They're paired with a high deductible insurance policy. And a lot of the insurance policies that are being sold on the exchanges, the Obamacare exchanges, are high deductible insurance policies. And so you can get these at work, you can get these on Obamacare exchanges. And the insurance policy, and I don't have the numbers with me, the insurance policy has a very high deductible. They have to be, you can't just do any health policy. It has to be compatible with an HSA, a health savings account. And so what you do is you get this insurance policy, it's a high deductible, and then you're allowed to put pre-tax money or tax deductible money, so it reduces your annual tax burden, sort of like an IRA or 401k, and you put this money into this savings account. A lot of employers will help contribute to it as well. You could put this money to fund the HSA in a bank, up to $3,300 for singles a year, $6,550 for a couple or family a year, plus an extra $1,000 a year if you're 55 or older. And so this is a bank account, and you use it, you could pay for your current health care costs. Let's say you have this high deductible and money is falling into the deductible, your services. You could take that money out tax-free and pay for your health care expenses. But even better, if you're getting this early on, let's say 40 or 45, you could save these accounts and let them grow, and you could use the money to pay for your health care expenses in retirement at any age. Once you're in Medicare, you can't contribute any longer, but you could take that money out tax-free to pay for your health care and your Medicare premiums, Part B premiums for anything that's medically related. So this is a number from Fidelity, 55 years old. I put in 7250. These were older numbers, adjusted for inflation. If you have a portfolio within your HSA, you could do it at bank, or you could do it at brokerage firms as well. 50% stocks, 50% bonds. In 10 years, you'll have 90, you're putting in this money every year, obviously. You'll have $94,000 at 65 in tax-free money to spend on health care. And this can grow over a period of time if you want to hold on to it. So if people have HSA, that they don't need that money now, put the money in, they're getting a tax break on it, let it build up over time, pull the money out tax-free for only Medicare expenses. Medical expenses. You have to pay taxes on it if you use it to, repair your house or something like that. But if it's medically related, you could use your HSA for that.
So I have a question.
Yes,
sorry.
of course.
Is this basically like a flex spending account, or is it something? How is it different?
It's different. The flexible spending account is a separate policy.
You can roll it over.
Okay, so you have, flexible spending accounts, another great way to pay for your healthcare expenses too, but you can't, I don't think with an FSA you could use it down the road. I think it's every year, of course, because I have one too, and
Yeah, use it or lose it every
you
year.
lose it or use
I
it.
use that for daycare.
I make sure I use up mine every year. But with an HSA, you don't use it or lose it. You could hold on to that for 20 years if you want. Separate account, but you also get this. You get the tax deduction as well. So you can have a lot of these tax deductible things going on for your healthcare expenses. FSA is if for something current. HSA could be current or future.
Are there any expenses that are kind of on borderline, we might think of as healthcare, but wouldn't be covered?
Well, what's a good thing to look at is, I forget what the IRS publication is, but if you go, there's a IRS publication, I forget what the number is, but it's called medical and dental expenses. And so what they do is they list all the allowable expenses for tax deductions, and they're the same expenses, eligible expenses for HSAs and FSAs as well. So that's, it's a lot. For tax deductions, lodging, if you need to go somewhere to, get a procedure, and your taxi cabs, your transportation. So there are a lot of hearing aids and stuff like that. So you could see the eligible list.
You could use it to pay transportation costs to go to.
There's certain, now the lodging, there's certain, and I can't remember if it's HSA. I know this is for tax deductions, but I think it's all the same. It's like $50 a night, plus a spouse or something like that. But it's all in the IRS publication and medical expenses. You could, during tax time especially. Yes, Linda?
I just want to clarify. If
Yes.
you can make I'm asking, can you make a contribution to the FSA?
FSA or HSA?
Sorry, HSA.
Uh-huh.
Separate from the cap on your contributions to an IRA or 401k.
Yes, it's different. And it's great because you have a couple of tax deferred or tax in HSAs. It's basically tax free income if you use it for medical expenses. So you can have your 401k or your IRA, and you could have your HSA. At the same time, you could have your FSA, and
That and your HSA you can spend on whatever you want after you're 65.
But then you have to pay taxes if you pay for anything other than medical expenses. So this is why it's a good pot for your medical expenses, because you get the tax break going in, and then you take the money out tax-free for medical expenses going out. But one of the problems that people have, we get a number of letters on, somebody is on, so it gets Social Security, and they're still working, and they're 65 years old, and they're still working, and they get their Social Security at 65. They love their HSA. They don't want to go on Medicare. They want to contribute. But once you go on Medicare, you automatically are eligible. You automatically get Medicare Part A, which is free, pays for outpatient services, and the minute you get Medicare, you can't contribute to your HSA anymore.
Can you pay your
So
premiums out of the HSA?
you can pay your premiums. You don't have to pay for Part A. You can pay your premiums out of the HSA. You can pay your Part
Without paying taxes.
Yeah, and I can't remember if you could pay Medigap or not out of your HSA. I don't. I'm getting my laws confused.
I think you can. We started it at the Miami Herald this year, and I joined it. But when they sold it to us, they were really, really pushing that because obviously
Yeah.
it
It's
lowers-
cheaper for them.
Yeah.
corporations for them.
HSA is
The
a
guy-
lot of companies. Yeah, I'm
The
sorry.
guy who came and talked about it said it really works if you're relatively healthy. The good thing is that, you know, it's deducted, so you can figure out, oh, I can only deduct this much for my cash flow. But let's say you then realize, I don't know, you need dental implants, which are a big expense, you can then add to that account, which was what it was attractive to me. If I have some kind of emergency,
So you can put the money in and then
In
take it back out.
and take it back
and
out.
it becomes tax-free.
That's how. it
That's
was
actually that's really
explained
interesting
to
too.
us. But I think it was mostly for relatively healthy people, because I think my deduction for a family is like $5,000 or $6,000. Well, I know I'm never gonna use that amount of money because I haven't.
But are you doing it?
I'm doing it, I'm just paying out of pocket for.
A lot of people do that. They put the money in, they get the tax deduction, they do the top 6,000 or 6,200 or whatever it is. They pay the money for their medical expenses out of their own pocket, and then they save this money and let it grow tax-free for their retirement. And then they have those.
But if you have some catastrophic illness or something, I think that's at least how it was explained to
Yeah.
us. You're cooked, essentially. So I think you're kind of gambling. But they really encourage the younger reporters, at least this is what our session was, because they tended to be healthy. The premium for the high deductible plan was like, 25% of what the only other option was.
Yeah.
But you're, I think, gambling still, that you're not.
Well, you're not gambling as soon as the HSA balance reaches your deductible limit. So in year 2 or 3, you've got 6,000 or 9,000 in there and your $2,500 deductible. Now you're risk-free. And you got a lower premium and you got a tax advantage. So
Well,
it's, to me,
only if that-
to me, it's a no-brainer.
That's how I thought about it.
Yeah.
I said, what are the chances to do that? But some people were scared off when.
Well, are you saying like a $50,000 medical bill?
Well, it kicks in and.
It kicks in
It
after
does kick in.
$2,500.
Yeah, I don't have the numbers with me, but it does kick in after a certain, I mean, the deductible, I wish I had written down those numbers, but the deductible is, $2,000 or something like that.
And it depends on, I've heard that some companies, the deductible is higher. There's a threshold where there has to be a certain deductible for you to have an HSA.
Right, that's what I've heard.
Yeah,
Ours
it's
happens to
federal,
be
yeah.
a little higher
Yeah.
than what I've read.
Yeah, so there are federal laws that require that, these
Well, the-
high deductible plans must have a certain deductible, but your employer can make them higher. I mean, if it wants.
So on interest rates on the HSAs, right? Because that's what you're doing, right?
Well, you're putting the money.
market.
You have to open an HSA account.
Right.
And there's a minimum to.
Yeah, and I don't remember.
To invest, I think it has to be more than 1,000.
So you can do it at a bank. I mean, you could. These are HSA. Yes.
Right. What I'm asking, I guess, are all HSAs created equal? That is, in
No.
terms of return.
No, because you could open one at Fidelity. I mean, there are all these different brokerage accounts, and the ones at the brokerage accounts, you can, I haven't looked at what the investment choices are for quite a while, but you can pretty much pick and choose what they are. You could,
It
you
depends
just
on what
can't go to the Las Vegas with it.
Depends on what your employer, it's just like 401k.
Right.
They'll trap you into 6 mutual funds or something.
Right.
Or if you're doing your own, you can go to TD Ameritrade
Yeah.
and
Yeah, and you
invest
could,
in anything you want.
exactly, and then you could play the market, with your HSA if you want. With penny stocks. No, I'm not sure you can do that. I'm not sure you can do that.
So every HSA account though is, it's invested.
Yes, and you could invest it in
It's not
a
like-
money market
it's not
account.
It's not like putting it in a bank account. a savings account and, you know.
Getting a certain rate of
Right.
return.
No, but you can put it in a savings account. But when you do this, when you get your HSA,
Right.
you have to open an HSA account. You just
No,
can't
I-
open your
I
little
know,
account,
I understand that, but you have the, I guess what I'm saying is you have the option of, there are HSA accounts out there where they work more like a bank savings account than
Yes.
a mutual fund.
Yes, you could do anything,
Okay.
basically, as long as it says HSA.
Right.
You know,
Right.
and the high deductible plans can't just be any high deductible plans. It has to be an HSA compatible high deductible plan because they have to meet certain standards of
Right.
benefits and so forth. A lot of the bronze plans on the exchanges, you know, there are 4 metals, bronze, silver, whatever, are HSA plans as well. We recently did a story on that as well. So it's a good way to save that money over a period of time. Another way, spending, you know, to save, to pay for expenses in retirement, is to cut your spending generally, and there's so many ways to do it. Number one is to take advantage of of free services. Under the Affordable Care Act, Medicare offers now 20 preventive types of services, many of them free. Annual wellness exams, screenings for prostate, breast, colorectal cancers, flu vaccines. Take advantage of people could take advantage of those. People in pre-retirement years who are on the exchanges, the ACA as well is requiring the plans to offer certain free wellness screenings. So that
Yeah, I was gonna say, is there a way to access that?
well, you know, if you're looking for the Medicare stuff, you can look at Medicare.gov. I sent you folks a list of really great healthcare related websites. And one that I love and use all the time is Kaiser Family Foundation. So take a look at that. The information is out there. A lot of information on Obamacare and what it provides. And, you know, the healthcare.gov may not have done a great job in, you know, getting people to sign up, but it does provide a lot of information on the Affordable Care Act itself and all the details. So, Jane?
Susan, do you know what the fidelity number, the 220,000, how much of that is predictable? Is that, I mean, how much is just premiums and not?
Well, I mean,
co-pays?
you know, I'd have to take a look, a good part of it, because if you start looking at what premiums are for all these things,
Right.
and you sort of inflate it out, or whatever, that's a word, it's a tremendous amount of
Right,
it.
but you're not gonna get hit necessarily, I mean, I'm just wondering, in terms of the unexpected health costs, not long-term care, is there any kind of,
I think they probably
Right.
throw, you know, I don't remember, but I think they put in a certain amount of, I mean, even if you have a Medigap policy, it's not going to cover everything,
Right.
you know, and the Part D is still going to have out-of-pocket costs too. With
the
it.
Medigap would not cover, I mean, I know
Doesn't
that
necessarily-
dental and vision.
It doesn't necessarily cover everything. I was going to get to that in a little bit. There are lots of different Medigap plans, and some of them have high deductibles. Some of them have, you know, they don't cover the full deductible for your hospital Part A costs. So I think they've probably taken into consideration the types of plans, you know, that you buy.
But could you figure that out? I mean, if you say, okay, I'm gonna get like Plan F, and I'm gonna get Part D and Plan F and Part B, and could you kind of add it all up and
You-
add up the potential out-of-pocket expenses and
I-
think, okay, well, that's gonna be it.
Well, I don't think you could ever really figure out exactly what it's going to be, but I think you can get a really good ballpark for it. I think the 220 is a good starting place. Or if you want to do your own, you could sort of look at, you know, what Part A, what Part B is, what Part D is, what Medigap is now, you know, typical plan. and then just sort of figure out what it's going to cost over, if you add inflation, and then sort of look at, well, maybe I'll have 5 implants or whatever. I mean, you could just, it's like anything. It's like your taxes. You don't really know what your taxes are going to, when you do your retirement budget. You don't know exactly what your your taxes are going to be, or your maintenance costs, or property taxes, but you get a good idea of what they could be, and then you add an inflation factor, and then you just sort of
Right.
get that idea.
I
So
guess what I'm wondering, just in terms of coverage also, is, when you always are reading this thing, references to these catastrophic health costs. And I'm just wondering if that's really long-term care costs?
a lot of it's long-term care
So
costs.
it's not really necessarily catastrophic health costs if you have all of your.
If you have everything in place, you're going to be pretty good shape. I mean, maybe you want a private room in a hospital, but Medicare pays for an incredible amount of stuff. I sort of wish we had it for everybody, but that's a political issue. I'm not going to get into that now. So, another thing, I know this sounds like, like we like when people, but anyway, there are a lot of health techniques for seniors. I mean, there is a lot of evidence out there that if you do stay, exercise and so forth, wellness groups and all that stuff, you can reduce your health care costs over time. And I don't have those epidemiological studies with me, but there's a lot of stuff out there. If you're buying, another way to cut costs, if you're buying coverage in the individual market, stick to your in-network provider. Your out-of-pocket costs will be much lower by going with your in-network provider. A lot of studies out there that show the numbers there as well. And if anybody wants them, you just send. I'll get out my card. Send me, and I could get those for you. But they are out there. I didn't want to list everything because I haven't even gotten to the It's 11:20. I haven't gotten to Medicare or the Affordable Care Act yet. If you're retired and paying a huge amount out of pocket, you're not on Medicare yet, you can negotiate on price. We've done stories on healthcare negotiations. So let's say you're 60 and you're uninsured. Hospital charges hospitals charge uninsured people more than they charge insured people, because the insurance company will negotiate a price. So go to a website called it's Healthcare Blue Book. Healthcarebluebook.com, and you can find the fair price. They call it the fair price for surgical procedures, lab tests, doctors, and dental services, and even hearing aids, and say, I want the fair price, and see what they say. Well, oftentimes they'll say, okay, they want to charge you $2,000, and it's like, well, the fair price is $500. Okay, that's fine. Because you don't have you don't have the negotiating power that the insurance companies have. Another good website I just came across, I did an editorial on this, is avoiding unnecessary procedures. There's a new website called choosingwisely.org, set up by this foundation. They went to 70 medical specialties, and they said, list 5 questions that patients and physicians should ask about procedures that are not necessary. For instance, you don't need a certain bone scan if you have prostate cancer. I mean, there's a bunch of stuff that they found that a lot of physicians are doing these things because patients want them. A lot of physicians are doing things because they fear malpractice. But this is a really good website to look at and see, if you're, to go with this information, that people can go with this information armed with it when they see their doctor, and to know that maybe these things that you think you want or the doctor is even prescribing may not be necessary. At least it starts a conversation with your doctor, and your doctor might say, listen, I know that website or that's the general practice and the general idea in the medical specialties, but this is why I think you're an exception to that. But at least you're starting that conversation. And then compare costs. Medicare.gov you can compare costs on nursing homes, on labs, and all this stuff. There's a lot of outcomes research and a lot of cost comparison research on Medicare.gov, and on things like on let's say Aetna. You're a pre-retiree, you're getting your insurance from Aetna, and there are lots of tools that you can use to compare clinics and so forth in your community. Find the cheapest one. Another thing is avoid the emergency room unless you really have an emergency. I have a couple of other strategies for cutting costs, but let's move to, people want to talk about Medicare, or people want to talk about ACA? Well, okay, let's start with the Affordable Care Act, and I'll try to talk faster. For people who are in their 50s and their 60s, do not have employer-sponsored health care, Obamacare can be a godsend. It's great for people who are early retirees and not yet eligible for Medicare, and it's great for the self-employed retirees and people who are self-employed as well. These are the people, as you know, have the most difficult time finding health insurance. So under the ACA, insurers cannot deny someone coverage or charge someone more because they have a pre-existing condition, which a lot of people in this age group have, and nor can they drop somebody once they develop an illness. Before Obamacare, individual plans on plans on the individual market could charge older folks 5 to 6 times as much as they could charge younger people. Under the ASA, this range can only be 3 times as much. So older people will be charged more, but they can't be charged much more. So this is good for older folks who are sicker and seeing maybe their premiums in the individual market decline. For younger people, it's worse because their premiums have been rising, and of course they're not enrolling as much as Obama had hoped, because as you know, there's the pool where the younger people who don't who pay the premiums but don't go to the doctor or hospital end up subsidizing the older folks who do get sick, and so this pool is really important for Obamacare to work well. And so what's going to be a big story down the road is to see what happens with these premiums during the next open enrollment period, which starts really in November. So it could be if younger people have not enrolled and the older people are getting a pretty good deal right now, those premiums could rise for the older people if those pools have not worked out. But this is not to say for older people the deductibles and so forth and co-payments are affordable. Some older people are doing worse than they did before in the individual market. Others are doing better. Some people have lost their physicians. That's
going to be one of my questions. What I'm understanding about them is that they tend to be fairly restrictive.
These are narrow networks. A lot of these plans have what's called narrow networks, and so they can be very restrictive. But for people who are not getting insurance before, better, some doctor than no doctor. Other people are losing their doctors. I mean, there are pros and there are cons for this. My sister and her husband are self-employed. They're in this age group, and they had to. They lost their doctors. They found somebody they found a couple of doctors they liked, but they did lose the doctors that they had been using. And so there's a lot of uncertainty what's going to happen in the future. Open enrollment begins November 16th and ends February 15th. So you may wanting to start doing, if you folks are covering healthcare, you may want to start thinking about doing some stories before. Yes?
I'm curious too, do you think that we've seen older workers who have stayed in the workforce because they wanted their employer-sponsored healthcare feel more comfortable leaving now that they've had these changes?
I think that was going to be another thing I was going to say, that there are certain, that is going to happen if it isn't happening already, that people who are really tied to their jobs didn't want to leave because they couldn't get affordable insurance are going to be leaving. And that was a big controversy. It's going to hurt the job market and so forth. I don't think it's going to happen in such a big way that that it's going to hurt the economy. I'm not an economist though, but I think it's going to give people more of an opportunity to become self-employed, or maybe to retire earlier, start new businesses, maybe work part-time and change their lifestyle a little bit. That's a really great local story to do. People who now can get there, people who are 60, 62 years old, don't want to stay in their full-time job anymore or this particular job anymore, and go out and get it's older people and younger people, but there's a lot of self-employment, a lot of businesses being started up by older people, a huge amount of people starting small businesses. And so this, I think, the Obamacare could help. A lot of people will be leaving their jobs to
I've
do
seen a
this.
couple of stories using anecdotes. Like
Yeah, I think it's a great story. I should do it myself. But
I'd be curious, anybody else has any ideas? I've tried to track this and just found anecdotes. The BLS doesn't track it very well.
yeah,
Episodically, they don't get funding for
People
it.
leaving this reason, people
Well,
leaving their
not
jobs.
just startups, small,
Oh, so-
self-employed and whatnot. The alternative work arrangements.
There, let me think, because I did find something that was. the
I mean, just
BLS,
finding
yeah.
statistics on it is really tough.
well, I was thinking of doing a story on the small business startup stuff.
Yeah.
The Senate Aging Committee just had a hearing on this, so on senior startups. So they may have some numbers there. I've seen some other things too. I don't know if it's a Kaufman Foundation.
It was the Kaufman Foundation.
Was
That's what I
it?
was trying to think. They do keep on, it's not exact.
Kaufman, yeah.
Yeah, they
I
did.
checked with them too.
They didn't have, yeah.
Well, the BLS is more comprehensive, but it's more
Yeah.
episodic, and it's not regular.
It's something I was going to look into. So if you want to give me your card, I'll give you my card, and then I could try to get some of the
I think
information
it's a great story.
for you. I think it's really a good story, and especially the older people. A lot of younger people too, but if you combine it with the sort of the growth in startups among older people, the baby boomers, the pre-65 people who are not eligible for Medicare yet, along with the ACA, I think it could be an anecdotal story, but it could be something that would be an interesting story.
Encore.org.
Oh, Encore.org would be great too.
I don't know how much stats they have
Yeah.
to point you, because they're all about second careers for older people.
Does anybody want information on how the subsidies work especially for older people? I mean, these are tax credits, and people who are under 400% of the federal poverty line will, a couple or family, $62,920. That's 400% of the poverty line, and $46,680 for a single person. And they have caps. A person who's eligible for a subsidy cannot pay more than 9.5% of income on a premium. And so that's for 400% of poverty. 200% of poverty can't spend more than 6.3% of income on a premium. So for an older person who's maybe an early retiree, this is sort of like nice news, because if they're eligible for a retiree, they will actually get a larger one than a younger person at the same income. And that's because their premium will be larger. As I said, it could be 3 times as large. So let's say you have a 30-year-old and a 60-year-old whose premiums are capped at 9.5%, and neither will pay more than $5,700 out of pocket for their insurance because of the way 9.5%. Because the older person's premium is larger, he or she will get a larger tax credit, to cover the rest of the premium cost. Kaiser Family Foundation has got a great subsidy calculator. You could play with the numbers. It's really fun if you like that kind of stuff. That's fun for you. And so you could see how the whole thing works. They have a really good explanation of. So let me give you an example. 60-year-old couple with an income of $58,000 a year. That's 374% of the poverty line. So the premium for a silver plan would cost $13,761. That's just in this example. They would get a tax credit of $8,251 and pay out of pocket $5,070. That's a monthly premium for a couple of $422 a month. And so $58,000, this is adjusted gross income, it's pre-deduction income. So let's just say, and I don't want to get too much into a whole tax policy, it's $58,000, just, this couple, but they're really spending maybe $70,000, but they're pulling money out of their savings account for the balance. So that's income that doesn't go into their adjusted gross income. I know that sounds like it's too much to throw at you. But so they can have a fairly decent income a year and still be able to get this subsidy depending on the sort of tax strategies that you use. And again, you could go on our website, you'll see some of the stories we've written, and I'm happy to send you anything if you want some more information. Some of the trends I'm seeing from the ACA that I think could lead to stories, as we mentioned, older people getting jobs, leaving jobs earlier than they planned. One other story, and I left you an article that I just recently did, and this is going to be an issue down the road because people, the subsidies are based on your income, on what you thought your income was when you signed up for Obamacare. If your income goes up during this year and you don't tell the IRS or the marketplace, you could end up owing a lot of money when you pay your taxes on April 15th. So read that article. It's really going to be a big deal. A lot of people are going to be owing money, and maybe some people get a bigger refund though too.
I wanted to ask on the income, so is it like people were going to withdraw that from a 401k, they might want to reconsider that? Would that be throwing them up if they, bring in that subsidy?
Well, yeah, because if they were drawn from their 401k or their IRA, they are going to be paying, that goes into their adjusted gross income. Okay, so that adds to it. So adjusted gross income includes your wages and your, distributions from your IRA, your 401k, your interest income from your bonds, let's say, or from your CDs, although they're very tiny, your capital gains, the sales of bonds, stocks and so forth. So that all goes into your adjusted gross income. So the trick is to keep your adjusted gross income under the 400% of poverty, so you can get some subsidy. You can play around a little bit with that. And that brings me to something that I'm going to talk about in my time's going to be running out on Medicare premiums, that people are paying their standard premiums $104.90, but people with higher incomes now pay income-related premiums, and that's based on their adjusted gross income as well. So the trick is, if you think you're going to be owing that income-related premium, try to keep your adjusted gross income down. I'm not going to get into it. Okay, we talked a little bit about the narrow networks. That's another thing you could be writing about down the road. People who've lost their doctors. Maybe for some people may not matter, but you may want to find people in your community who are happy with their doctors, the new doctors, or unhappy with their new doctors. Also, you need to be looking at whether it's your exchange program or your Medicare program. You really need to be checking not only whether your drugs are covered in the program, but the size of your out-of-pocket payments, your co-payments, your deductibles for drugs, and so forth. I'm going to move on to Medicare. Also, another thing too, and this could be happening in your community, a lot of companies have been paying for retiree health insurance for their early retirees, the pre-65 folks. A lot of companies are dropping that, maybe giving some money to their pre-retirees, to their early retirees, to buy health insurance on the individual market or the health exchanges as well. So you might be finding people who had first dollar coverage and so forth from their companies before they retired, when they retired at 60 until they were 65. Now they may be getting a certain amount of money to go to buy health insurance on the exchanges. Medicare, I'll go through this really quickly. Medicare Part A, free, covers outpatient services. There's no premium for people who worked and paid a payroll tax. There's a deductible of about $1,200. Part B pays for outpatient most people, as I said, pay a standard premium of $104.90. People who earn adjusted gross income of more than $85,000 for singles and $170,000 for couples pay a surcharge of as much as $230 a month for a couple. So a couple with modified adjusted gross income of more than $214,000 a year would each pay the standard $104 plus the $230, that's $104 each, for a total of $440 a month, or about $5,300 a year for their Part B premiums. This is something you need to consider down the road when you're planning for retirement if you think your adjusted gross income is going to remain as high as it is now. Not a lot of money for somebody with adjusted gross income of $214,000, but what's happening now when they started this program, this income-related thing, a few years ago. Just 5% of people were caught by this. What Obama is hoping for is that 25% of people will have to be paying the higher income-related premium, because what they're not doing, it used to be they would adjust the threshold, the 85,000 and 170 for inflation. They're keeping it level now, so more people are getting above that level and will be caught by these higher premiums. One way to keep under is to try to stay under that AGI level. Maybe not take that money from your IRA, your regular IRA. That'll boost you into a higher income level. If you have a Roth IRA, you could take the money out of the Roth to keep under that level, because the Roth is tax-free, and it does not count towards your adjusted gross income. Another New Yorker, I love New Yorker cartoons. I found them for everything except for annuities. There's no New Yorker cartoons for annuities. Okay, yeah, I know, exactly. And this is an old lady saying to this little girl in a stroller with this younger couple, I just hope that when your mother is as old as I am, you'll be able to help her figure out Medicare Part D. Open enrollment for Medicare Part D, which is your prescription drug plan, and for Medicare Advantage plans is October 15th to December 7th. So if any of you are covering this stuff, I gave you an article on open enrollment. It's written by Kim Langford, great reporter, does work for the magazine and for us. And that's when people can change their plans. We recommend to people, even if they have a Part D plan, that they look at it every single year, because these companies drop drugs from the formularies, or they put them on a different pricing tier, which means you'll pay a higher out-of-pocket cost for the same drug that that you had been using. So you want to take a look every year at what your this plan is offering. There's a great tool that you can use on Medicare.gov, the Plan Finder. And what you can do with this is that you can take all the drugs and all the dosages that you have, and you stick it into this tool. It's hard for older people to do this. So there are services that will help. There's state services that can help, in local housing area aging agencies that can help older people do this. Put all the stuff in the tool, and you could see all the plans in your community, what your out-of-pocket costs will be for each plan based on the drugs and dosages that you're using. People who are paying income-related premiums for Part B are also paying it for Part D. They're paying an extra surcharge to the government if your incomes are above the AGI level that I said before. So it's Part B and Part D. And all these plans vary in their copays, their coinsurance. Copay is, you pay, like $5 per drug. Coinsurance, you pay 25% on a drug. So one's a set fixed price, one's a percentage. A lot of these the Part D plans are moving to coinsurance. They're paying a certain percentage of their drugs, and they're changing their pricing tiers. So a brand name drug that was on a low pricing tier, it may be on a higher tier now, so your co-payment will be different. So average premium for Part D is about $40 a month. Ways to, and also these plans will also, the plan finder will help you determine when you'll get into the dreaded donut hole. One of the things in the ACA is that the donut hole will shrink over time. You'll be paying less for brand name drugs and generic drugs as well.
Shouldn't it go away, or like 20?
Well, I keep seeing that they say 2020 it disappears, but then I look at these numbers and it says you'll still be paying 25% of your generic drug costs and 25% of your brand name drug costs. So I'm not sure exactly how that works, but at the very least it will be shrinking over a period of time. To save money with Part D, older people, I mentioned too the plan finder and the prescription plan prescriber.com is a good tool. It's on the sheet that I gave out. ARP is a good donut hole tool. Other ways to save money is if people order through a mail order pharmacy and order in bulk. These plans have different deals with mail order pharmacies, so you may want to do. They also have deals with preferred pharmacies, so you might get a better deal at Walmart than you may have at CVS. So you really should be looking at the preferred pharmacies and what kind of deals you can get with those as well. Also generics, most of these drugs, they are just as good. So your basic costs will be lower, your co-insurance rates are lower. Lipitor, which used to cost $180, if you go with the generic, it's $14 a month. And some of the you may want to look at some of the patents on a bunch of brand name drugs are expiring. Celebrex, Nexium, to name a few. I won't have time to get into Medigap, but oh well.
Question. I know that when you hit 65, you have to sign up for Medicare.
Mm-hmm.
You also have to sign up for Part B within a certain period. Is that correct?
Yes. So this is another thing people should really worry about. You don't have to sign up for Medicare at 65. You can hold out. The enrollment rules are a little crazy. They're very complex. So I did a story a couple of years ago. You could find it. Look under Medicare enrollment rules, navigating the rules under my name, and you can get an idea of what all these crazy rules are. So let me give you an example of things you could be warning readers about if they want to save money. Let's just say you're 65 years old, you're still working, and you don't have, let's say it's 66, you don't have to sign up at 65. You have 8 months from the time you leave your job, let's say it's 66, to sign up for Medicare. Otherwise, if you don't sign up during that special enrollment period, you will pay a 10% penalty, for the rest of your life, a year for the rest of your life, and you will not be able to sign up. Well, you could. Let me step back for a second. Let's say you're 66. You leave your job. You go on COBRA for 18 months. You don't want to go on Medicare. You love your health insurance plan. You just as soon stay on the plan, even though you're paying the full cost out of your pocket. Your premium and the employer's premium. But you love the plan. You're too lazy. You don't want to sign up. 18 months go by. Oh, I'm going to sign up for Medicare right now. Well, you're going to be out of luck because you're on COBRA. That doesn't count in that 8-month special enrollment period, which only attaches to the time you left your job. You have 8 months after you leave your job, not after you leave your employer-based insurance. So let's just say I leave my job at 65 or 66, I stay on COBRA, 18 months later I want to go on Medicare. It's July. I cannot sign up for Medicare at that point. I've missed my special 8-month enrollment period, months and months ago. I have to wait till general enrollment period in January to sign up. But then it doesn't kick in until the next July. Okay? So you're a whole year without insurance. All right? So there are a lot of these complex, crazy rules that people have to understand, especially if they're working longer than 65. Medicare Rights Center, MedicareRights.org, it's a great website, has a Medicare interactive website with all these different rules and regulations on enrollment. As I said, I wrote a story on all these things as sort of a Q&A, and get a lot of information there to give you some idea. So much to say, so little time.
Susan, thank you very much.
Okay.
And here-